On this episode of WarDocs, retired Army Colonel Dr. Joshua D. Hartzell shares his journey in military medicine, discussing his motivations for joining, his specialization in internal medicine and infectious diseases, and his deployment experiences. He emphasizes the importance of leadership development, compassionate care, and collaborations in high-stakes environments. Dr. Hartzell also highlights the challenges of resource constraints in healthcare and the need for effective leadership practices to navigate these issues. He emphasizes the importance of setting high standards, providing feedback, and taking care of people as foundational elements of effective leadership. Josh shares personal anecdotes and insights that highlight the value of mentorship and the responsibility leaders have in shaping future generations. For more information about Dr. Hartzell and our previous guests, visit our website at wardocspodcast.com. Be sure to follow WarDocs on your preferred podcast platform and subscribe to our WarDocs YouTube channel. I'm your host, Dr. Doug Soderdahl, retired Army urologist.
Welcome to WarDocs, the military medicine podcast. This show brings you a firsthand, behind-the-scenes look into the mission, unique opportunities, and deployed experiences of the entire military healthcare team. From state-of-the-art hospitals in the United States to the most austere environments across the globe, WarDocs has you covered.
Today, we're privileged to welcome retired Army Colonel Dr. Joshua D. Hartzell to WarDocs. Josh, thanks for joining us today.
Thanks for having me, Doug. Glad to be here.
So you spent 25 years on active duty in military medicine, retired as an Army Colonel. Can you tell us about your, original journey? What drew you to join military medicine?
Yeah, that takes me back a few years. So, when I was growing up, I had a big passion for history, and a lot of that history was military history. And I read a lot when I was a kid. My parents took us on vacations, and almost all of the vacations, one, were driving, but two, were somewhat related to history. I think they wanted us to see different things and learn about different things. And so as I sort of got older, I was really drawn to military service through a lot of the history I'd read. And when I got ready to go to college, the other sort of important aspect of that was, how was I going to pay for college? And the Reserve Officer Training Corps, ROTC, was a great option. And so I thought, you know what? I love the military from what I've read about it. It would provide me with some great opportunities to get outside of a small town where I grew up and go to school, hopefully without having to pay a lot. So it seemed like a win-win. And fortunately, it worked out probably better than I could have ever imagined.
So you eventually wind up training in internal medicine and specializing in infectious diseases. What led you to choose that particular or those particular specialties? And was there any specific experience or a mentor early in your career that guided you toward this path? And what kind of opportunities are available for an ID doc or internal medicine doc in the military?
So when I was a medical student, we all do our clinical rotations, and I had the opportunity to rotate at Walter Reed Army Medical Center at the time, now Walter Reed Army National, or Walter Reed National Military Medical Center. When I rotated there on my internal medicine rotation, I just remember sitting in morning report, and this was sort of very old school at the time. Someone would present a case and they would call on one person, and that person would have to discuss the case for, it seemed like 10, 15 minutes they would sort of go on. And as I watched this, I just thought, these people are amazingly smart, and they take great care of patients, and they take care of patients that are really, really sick. So I was drawn to that idea that as a physician, I would be able to take care of really sick patients, no matter where they were at in the hospital, aside, of course, from surgery. So I think my early experiences of seeing those residents and just thinking how amazingly good they were drew me to internal medicine. And then in terms of staff, one of the unique things about military medicine is that you actually end up getting to work with the same staff more than once, which I think in the civilian sector can be not always the case. But I worked with Chuck Oster, and I don't know if you ever worked with Dr. Oster, but I worked with him as a third-year medical student, a fourth-year medical student, and then I worked with him as an intern, a resident, and a fellow. So literally every stage of my career. And when I was a student, he was an amazing teacher, great educator, great clinician. And again, that was sort of the model of who I wanted to be. And I got to see him do that day in and day out. So he was a big influence. When I was a resident, I got to work with Colonel, now retired, Glenn Wortman, who was very similar. He was just a terrific clinician. I mean, very good at infectious disease and internal medicine, but also was very academic, did a lot of teaching, did a lot of research, and those were things that I was interested in. So between sort of the two of them, I was really drawn both to the specialty of internal medicine and then the specialty of infectious disease. The other thing that I guess I would say is from a military's perspective, I had kind of thought at this point that I was going to be a career military person. I already owed 4 years from ROTC for my commitment and payback. I owed 7 from the Uniformed Services University. So it's like, I'm going to be in for a while. And infectious disease is definitely one of those specialties that has a very important role in military medicine. Anywhere we go, there are infections. How do we treat them? How do we prevent them? So I like the idea that military medicine nested well with infectious disease as well. And, to sort of answer your last question, opportunities for, I'll focus mainly on infectious disease physicians. I mean, you honestly could not be in a better place than in the military. If you want to do clinical medicine, check. There's places all across the globe. Literally, I just talked to one of our colleagues who was in Germany currently doing her infectious disease time. We have research facilities across the globe. So if you want to do research, you can do that. We have Walter Reed Walter Reed Army Institute of Research, RARE, which has done some of the most important infectious disease research probably in the last 50 years on different topics. And then we also have medical education and teaching. And oh, by the way, we have, infectious disease physicians who are currently general officers as well. So you can really do it all, which I think is, true of all specialties, but certainly of infectious disease, that it's almost like you're a stem cell and you can evolve into, what suits you best.
So you had the opportunity to do what we train for in military medicine, and that is to deploy. And you deployed as a battalion surgeon with the 82nd Airborne Division to Afghanistan. Can you take us back to that experience and what was a defining moment during deployment? And did you feel prepared to perform your duties? I mean, you're an ID doc, and now you may be doing some different stuff. So how did that go?
I don't know that you ever fully feel prepared. I would say I felt prepared and confident based on the training I had had. I mean, I thought that first off, ROTC had sort of given me a lot of background and skills in terms of the military and leadership. I was fortunate enough to have gone to airborne school and air assault school when I was a cadet. So I felt like that was helpful and also gave me a little bit of street cred with some of the line when you get there and you show up and you've done some of those things. I think clinically, the training you get in the military is top notch. I would say it's as good as any place you can go in the country. So clinically, I felt prepared from an infectious disease standpoint. And then Tactical Combat Casualty Care Course, or TCC or TCCC. Yeah, I had the opportunity to do that right before I deployed, and that was really, really helpful. One, it helped me feel more confident in terms of some of the clinical skills and things that we would be expected to do in terms of, whether it's tourniquets or crikes, doing other things that we would also have to train our medics on. So that course was really helpful. The defining moment, I don't know that there would be one. I mean, I think there are some, but one of the things that really stood out to me was when I arrived at our base, which was, I was in Farah, Afghanistan. We were co-located with a Navy Provincial Reconstruction Team as well as a Marine Special Ops MARSOC unit. And one of the things that stood out to me was just how critical the collaboration was between those different aspects, because we all had slightly different roles there, but medically at the end of the day we all had the same role, which was to take care of our soldiers, sailors, Marines who were there. And I think that ability to collaborate became necessary very quickly as we recognized that we were going to have to work together to be successful. And fortunately, both of those units had some really amazing leaders, both enlisted and officers. And I think that ability to collaborate across units was really, really important. And then we also had our allied partners as well. So we had an Italian unit there. We had to coordinate with them and also partner with them. So I think just that idea of collaboration and getting there and recognizing that this is what it's going to take to be successful is really important.
So you kind of explained, how military medicine involves unique challenges in the combat zone to also training the next generation of physicians. Can you tell us about a pivotal time, whether during that deployment, a tough case, teaching moment that really crystallized your commitment to developing leaders? And how did that connect to your decision to write a book about leadership? And I'll put it up in front of us. It's a prescription for caring in healthcare leadership, building a culture of compassion and excellence, available now on Amazon. I got a chance to read it, really enjoyed it, and we'll talk a little bit more about it. But what led you to this?
I would say a couple things. One thing I think for me that was really important early in my career was when I was a fellow. This was sort of at the height of Operation Iraqi Freedom and Operation Enduring Freedom, OIF and OEF, and we were taking casualties at our hospital. I mean, if not nightly, several times a week. And when I was an infectious disease fellow, we saw a lot of the infections that these service members had, and they were pretty horrific at times. And I think I kept thinking to myself that, if these soldiers, sailors, airmen, and Marines are willing to go down range at the risk of some of the things they're going to be exposed to, then we have to be overly prepared to take care of them and support them medically, whether that's stateside here or whether that is, OCONUS or whether it's in a deployed theater somewhere. Our job and responsibility is to do our absolute best to make sure that they get home safely to their families. So I think just that level of responsibility became very clear to me seeing all these injured service members. So that was certainly inspirational, and it's still something I think about. The other thing was not necessarily a specific event, but over time, what I noticed was that most of the problems we faced were not clinical issues. People are really good clinically within military medicine, and in the right setting, they take care of the clinical problems. What the challenges were often these outside issues or leadership issues. Was it a resource issue or a time issue, or how do we invest in our people type of issue? But it all came back to not clinical but leadership issues. And so I think as that went on over my career, I started asking myself, well, how can we better prepare our people for these situations when they're going to be leading? I think I got lucky as well that when I was an early faculty member at the newly formed Walter Reed National Military Medical Center. So I was there when we bracked and when we took our patients from the old Walter Reed to the new Walter Reed, like sort of the last group of faculty before the hospital closed. But working with the Navy physicians, and in particular their interns, you would finish your first year of postgraduate training and potentially be on a ship in the middle of the ocean and be the medical advisor to a commander, or you would be working with the Marines and being advising to the commander. And so, what are we doing to prepare them, not just clinically, but also from a leadership perspective? Because they're medics, they're corpsmen, they're all looking to them as a military medical corps officer and a leader. And similarly, when we finish our training, whether in residency training, we very quickly get put in leadership positions. I think in the civilian world, you maybe practice, but you're not a clinic chief, a department chief right away. You have some time to sort of grow into that. I think in the military, we get pushed into those a little quicker. What I wanted to do was start to identify ways that we could better equip people to handle those situations. How do we train people more effectively to be leaders? So that really became a passion of mine over 10 years ago, and then really have sort of just built on that. And the book was kind of a compilation of studying leadership, thinking about leadership, developing leadership curriculums for the military, and then also doing a lot of outside reading and thinking about it. And as I think back now, people always ask me like, well, there's all these other leadership books, but there was never really a particular book for healthcare leaders. I mean, I can give you many books that I've given to people over the years, but they're all business books or military books. My hope would be that this book provides and fills that gap where if you're working with somebody who's a junior clinician or a resident and you want to improve their leadership skills, you just take a copy off your desk and you're like, hey, read this. This will help you be more effective. And similarly, if you're someone who's been leading for 25 years and you want to sharpen your skills, take a look and see what else you might be able to do.
Yeah, I can definitely say that I could have used something like that. After my internship, this was back in the days for really competitive surgical training, you went out and did a GMO. And so I wound up being a clinic commander, medical detachment commander in the middle of nowhere, Korea. And the clinical stuff wasn't as hard as, leading that unit and being the commander. And so it's nice to have that kind of resource. In the book, you emphasize humility and active listening as cornerstones to caring leadership. Can you share a specific example from your experience where these traits directly improved patient care or team morale, and how healthcare leaders can practically apply that in especially high stakes environments like deployments?
The example I always go back to, and he sort of lived this through his career and is still doing it, is Colonel now retired Greg Argyros, who is president of MedStar Washington Hospital Center in Washington, D.C. And he was our residency program director, so a very early influence on my leadership. And I don't know that I noticed it at the time, but certainly as I started progressing in my career, I realized just sort of, how well he did these things, and really that idea of active listening and being humble. I mean, every morning, he sat at the front in morning report. He was certainly the smartest, if not one of the smartest people in a room, but you would never know it by how he interacted with people and how he was, humble with listening and humble with giving feedback to others. And he sort of, when we would come to him with problems in the residency, he would listen, he would think about it, and then he would either adapt and make changes or empower us to make changes, or he would explain why we couldn't do it, which I think to me is sort of a quintessential thing leaders need to do. He carried that over to his current job where at hospital center, he did a bunch of town halls and listened and fixed a bunch of problems. And, a lot of us have seen town halls or been part of town halls where you kind of get the sense that leaders really are there just to tell you their agenda, not to actually listen. He genuinely wants to listen and hear and learn, and I think it requires that inner humility. I think from a deployment standpoint, one of the things that we try to talk to our trainees when I was the residency program director at Walter Reed is, we all have things that we're really good at and things that maybe we're not as good at. And you just mentioned your example, sort of being in that clinic role as a 1 year out of training, right? I suspect you probably had non-commissioned officers who you worked with who were really good, who knew what they were doing. And for us, in the military, it requires some humility to say, hey, I'm going to let this, sergeant first class, this sergeant, this specialist who has more experience in this particular area, I'm going to let them run with this and lead it. I'm going to give them and empower them because one, I know they'll do a good job. And two, like, just quite honestly, that's not what I'm as good at, right? Like, you have to have that humility to let people lead who are better at the job. I think clinically, the example I like to use is, when we have patients who have swallowing difficulties in the hospital and we're meeting with families, I could lead that discussion, but not nearly as effectively as bringing in our speech pathologist and asking them to lead that discussion with the family because they know the tests in and out. They know all the stuff with foods they can and can't eat and all those things. So I think leveraging the healthcare team, whether it's physical therapy, discharge planning, social work, it's too specialized in all of these different areas for us to think we know it all. And it also, when we do that, what it does is it shows value and respect to our colleagues. And when we value and respect people at work, it makes them feel better about their work. It makes them work a little bit harder. And I think just simply by having that humility to let other people do their job well is critical within healthcare.
One of the things that's not necessarily unique to military medicine, but we see a lot is, not only having to operate under intense pressure, but operating with tremendous resource constraints. What kind of practical strategies would you suggest to leaders who have to lead in that environment? And how can a leader kind of maintain their compassion and caring when they're just frustrated by a system that can be bureaucratic or completely out of their control?
Can we skip that question? No. Uh, yeah, I guess a few things, and I think you're right. And I don't honestly. I think this is the way it is in the civilian world. When I talk to my civilian colleagues, they deal with very similar challenges. Resources are always going to be an issue. I think the first part is to be realistic. We are never going to have all the resources we want, so we have to recognize that internally. I think a lot of times we get really frustrated about things, and our frustration actually adds to the problem. So now not only we do not have enough resources, but we have not enough resources and a bunch of people who are really angry and mad. That's not going to make things better. So I think part of our job as leaders is to manage those expectations. Now we can't ignore things. One of my least favorite phrases is "We don't expect you to do more with less." And the reason why it's one of my least favorite phrases is because very often the same leaders who say that then expect you to do more with less. So I think you just have to be honest with what you're saying and what you're expecting. And, I do think you have to advocate, though. It can't just simply always be, well, you're not going to get that. You're not going to get that. How do we actually make changes or create change that does help facilitate some of the problems we have? And, that's different for each particular problem. But, part of our job as leaders is to come up with solutions. So whether that's us coming up with the solution or going to the people you lead and say, hey, look, we're short staffed. We're not going to get another provider. So for the next 3 months, here's where we're at. What ideas and solutions do you have so that we can get through this together? That comes up in a deployed setting where maybe you're spread out across the area of operations and you have to decide, for the Army, where am I going to put myself, potentially as a battalion surgeon or squadron surgeon? Where am I going to put my physician assistant? Do I have a senior medic or someone else who I can put somewhere else and leverage all those capabilities? I think it has to deal with, advocating, delegating effectively, and empowering others to come up with ideas. And then throughout that all, trying to maintain a positive spin on it. I know you've had Major General Clark on as a guest, and one of the things I learned from him, and it kind of stuck, and I think it's actually in the book as well, is that leaders lead through change, and it's going to be okay. And part of our job is to set that tone that despite whatever the circumstances are, we have to lead through it. We're going to get to the other side, and our job is to help people recognize that one is possible, and two, we will successfully get it done.
So one of the things I enjoyed about the book was at the end of each chapter, there's some reflective questions that kind of make you think back about what you just read about. Is there one particular question in the book that you found most transformative in your own leadership journey? And how did it shape your approach to healthcare leadership?
So to me, I think the most important thing is, and I have this in the chapter on preparing, is setting aside time to be a student of leadership. And if you want to read the book, great. If you want to listen to the WarDocs podcast, great. But going back to that earlier point about it's not usually the clinical things, but it's more the leadership things that are real challenges. The only way we get better as leaders is if we spend time intentionally studying leadership, thinking about leadership, and preparing ourselves for those roles. So if I was going to take one of the lessons in this book, I would say that is definitely a critical one. And the challenge I give people is 30 minutes a week. Can you fit 30 minutes a week in? I mean, you could do that on your commute to work. You could do that while you're walking your dog around the neighborhood. If you're listening to a book or a podcast, or if you want to read something, or just go talk to somebody who's a really effective leader and ask them what lessons they might have. It would be spend time intentionally thinking about and preparing for leadership. If someone asked you, do you feel like you wish some of your leaders would have spent a little more time thinking about or studying leadership? I think all of us have had some of those experiences. I'm sure people who have worked for me have probably wished, I wish he would have spent more time. But I think just dedicating that time to leadership development is critical.
Yeah, I mean, I think it's absolutely worth the investment. And one of the things I found from my own career is that you can see the return on that investment if you apply some of that stuff that you're actually learning. And sometimes people would come up to me and go, "All right, what book are you reading this week? Because you're doing something that's strangely new." Um, but sometimes it was a little less obvious than that. One of the things I also like about your book is, drawing on real world examples. And you mentioned, Dr. Clark, and he's actually our chairman of the board for WarDocs. You've also had other guests that we've had, Ramey Wilson, mentioned in the book. Can you tell us a standout story from your own research or career that illustrates the power of compassionate leadership and caring leadership, especially in a military context, and why that resonated with you?
I'll give you a couple. I do want to go back to the point you just made, though, about people noticing you doing something different. One of the things that I'll sometimes tell people when they're working on their leadership is if they're going to be trying something new, is you can actually tell the people you're working with. Let's just say you want to work on your listening. You might just go to your team and say, "Hey, look, I was reading this book. I realized that I'm not always the most effective listener. So here's a couple things I'm going to work on. One of them is anytime I'm listening to somebody, I'm going to put my cell phone down and make sure I'm not distracted. I would actually like you, if you see me listening to people or in a meeting and on my cell phone, to call me out on it and give me feedback on it. And in that way, they're almost cued in like, oh. And the other reason why I think that's important is it also shows to the people we're leading, wow, Doug is still working on his leadership development. Like, he's so established, like, but he's still doing it. Well, maybe I should do that as well. So I think it's great role modeling. Yeah, lessons. So I would say a couple. One of the people I interviewed for the book, and I think this is an important story because sometimes when people hear the term caring and leadership, they think kind of soft. But Amy Vertrees, who was in the Army surgeon, gave the example of Craig Shriver, who was the Army colonel who runs the Mertha Cancer Center now, who I'm sure you know. He set very high standards and had high expectations for his trainees. And one of the things that Dr. Vertrees talked about was just how, while those standards were high, and maybe sort of even at the time you would think, oh, is this harsh or whatever, but in reality, everyone knew that the reason that he was working was to help them get better, to help them be the best surgeons they could. And then I would add on to that to be the best surgeons they could to take care of our men and women who go downrange. He deployed multiple times. He knew what that needed. So I think one is just this idea of setting high standards for people, but then also coming behind them and making sure you give them the support, the resources, and the things to achieve those standards. So I thought that was a great example. The other example that I think is really a valuable one is I had the opportunity to interview Lieutenant General Mark Hertling, not a physician, but has actually written a book on physician leadership once he got out of the military. And he had a really great quote. And it was this quote that sometimes the most caring individuals are the ones who make you feel the most uncomfortable. And what he talked about was this idea of tough love. And, when he said that, it actually made me think back to people in my life who had the biggest impact on me. And these were not always people who were warm and cuddly, but they were people who were willing to hold me accountable and give me the feedback I needed. He also talked about non-commissioned officers and his examples and how our job is to give people feedback and help them get better. I had a Master Sergeant Ruiz, was my one of my cadre when I was in ROTC, and I had come back from airborne school over the summer and was feeling pretty good about myself, which is probably a kind way of saying I was a little bit arrogant because I just completed airborne school, and I was wearing a uniform that probably had reached its peak of wear time and needed was not necessarily the best representation of the Army. And he had no problems telling me that, and not only telling him it, but explaining that as an officer, when I got out with the units, that they were going to look at me as the standard bearer, and was what I wearing the standard bearer. And that really stuck with me. Like, the idea that people are going to be looking at you, you're setting the standard, you're a role model. And it took a little bit of a butt chewing per se to get across for me. But look, that was 20 some years ago. And it's one of the most important lessons I learned. So I think this idea of high standards, accountability, feedback, these are things when we really care about people, they're not easy to do. They're really uncomfortable at times. But when we care about people, we need to do those things.
Yeah, one of the things I would always tell folks that I would be coaching or mentoring is that, you're always in kind of a leadership lab. And so you can observe what other people are doing. But the thing that you may not recognize is that the higher you go in leadership, the more people are looking at you, and you are that standard bearer. So realizing that early is very important. The
And
other
can I can
thing,
I can
yeah,
I
go
just
ahead.
make one comment on that? Because I
Sure.
think that's essential. And one of the things we used to talk to our residents about was exactly that point. That every single one of us, and hopefully a lot of people listen to the podcast, every single one of us in military medicine, we represent military medicine. The way I show up in uniform represents every other military medical corps officer. The way I PT, way I do my physical training and show up and work with, to make sure I'm in the fitness standards and not just meeting the standard, but exceeding the standards, that represents the entire medical corps. So one of the lessons we tried to impart was that it's all of our responsibility to uphold the level of professionalism that we want and would desire for military medicine. And that, just as you said, everyone's watching us. Those medics and corpsmen in the hospital, they see what you look like. They know what your scrubs like. Are your scrubs all laid up? Is your white jacket completely dirty? How are you treating people? Right? We build the reputation and brand that we want within military medicine, and I think for us, we need to recognize that that means the way I interact actually influences the way people look at you. Right? So it's a collective responsibility for all of us.
Yeah, I remember when I worked for, General Clark, he would always remind everyone that we are Army Medical Corps officers. We're not just simply doctors in the Army, and that implies those dual professions, that we're in the professions of arms, and that has a standard, and we also have to keep the standards of the profession of medicine. We talked a little bit before about, how military medicine puts folks into leadership challenges or opportunities early, and we can learn from that. What other lessons do you think that the civilian side and civilian healthcare leaders can adopt from things from military that could build a more compassionate culture, and how do we get them to learn those lessons that we've learned in the military?
Well, I think fortunately for us, we all retire and we join the civilian workforce. So the primary way is when we leave service, we carry those lessons forward. I was just talking to Amy Yao, who was an Army nephrologist. She's leading the charge of helping to develop leaders where she works now, and that's a huge part of it. It's just we become part of those cultures, and how do we infuse what we've learned and been exposed to. I think the first one is actually just very simply taking care of your people. I mean, I don't know what your experiences were, but for me, like almost from day one, it was ingrained in me that my job as an officer was to take care of the people I was leading. When I was a cadet in ROTC, they would over and over, look, when there's a road march, your job at the end of the road march, which is for people who are unfamiliar, if maybe you're a civilian listening to this, is basically you put a heavy rucksack on your back, 40 plus pounds, and you go march for 6, 8, 12 miles. But your job as the leader was to check your people's feet maybe during or after to make sure they were okay. That was just what you do. For us in the Army, if you're out in the field, you eat last. You don't eat until the rest of your unit has eaten. And your job is to ensure that your unit, your people are ready and able to accomplish the mission. So it's that idea of taking care of your people. I wonder sometimes in the civilian world where there are maybe more financial pressures, other things that gets unfortunately put to the side. And I say unfortunately because there's a growing body of data, both within medicine, but even in the business world, that when you effectively take care of your people, they perform better. So whether you think it's the right thing or not to do, which it is definitely the right thing, when you do the things that support your people, they show up more motivated. They're less likely to be burned out. It's critical. And when you think about taking care of your people in terms of burnout in medicine, there's overwhelming data that, when physicians or nurses are burned out, it leads to worse patient outcomes. So by being proactive and taking care of your team up front, you prevent burnout, which leads to better outcomes. The other thing that I feel like we've been pretty good at is feedback and giving feedback in two ways. One is just on an individual level. Certainly from a military standpoint, when I was deployed, like commanders giving feedback, it's all the time. Like it's critical. You need feedback to make sure you're not making the wrong decisions. Very similar to what we do in medicine. I think the tricky part becomes when it's not related to clinical care, that then we shy away from the feedback. I'll give an example. Maybe someone you work with is really inefficient at running meetings. Everybody knows this person is inefficient at running meetings. There are people right now who are shaking their heads saying, I know exactly who he's talking about. But no one has ever given that person feedback. So, how do we expect them to improve if they haven't gotten that feedback? So, I think this idea that if I really care about our people and our organization, I have to give them feedback. And then the last part about that would be like after action reports or debriefing. Outside of like critical events, I don't know that that's as common in the civilian world. I think we do AARs or after action reviews very frequently in the military, certainly in deployed settings and during operations. But I think just that idea of how do we not only have individual level feedback, but also group level feedback.
Yeah, one of the things that I thought back to is, really taking care of your people includes understanding what motivates them. And I go back to Daniel Pink's book Drive. And if we can encourage that autonomy, that mastery, that understanding purpose, and I would add one more, give them some appreciation, let them know they're doing a good job. That goes an absolutely long way. In the military and in medicine, those are two, areas where you can make decisions that are, life or death. You're making something that someone's going to live or die based on your decision. How do things like active listening, humility play into those when you have to be decisive, but you want to remain compassionate?
I think part of this to me is we have a lot of conflict in the hospital. And even these decisions, which, obviously are maybe high stakes decisions. I mean, certainly there are times like maybe in the OR, other cases where like somebody has to just immediately make a decision. But a lot of times you have at least a second or two or a little bit longer, maybe to just pause. And I think for us, like that pause, and then one of the phrases that has always stuck with me is Dr. Woodson Scott Jones, who you probably know as well, taught me this very early in my career. And I don't know where he got it, but he just said, get curious, not furious. This has come up so many times in my career, and it's been essential. So, both for active listening and being humble. So, people bring you problems, and often there's a level of emotion attached to those problems. And sometimes we want to just jump right in. And like our immediate reaction is, I can't believe that happened. Let me go do X, Y, or Z. And I did that as a program director, probably more than once. Uh, and then there was more to the story that I hadn't gotten. So I had sort of made maybe an emotionally charged decision instead of being curious. Like I got a little furious and I wasn't curious. So I think that, to me, what we need to do is during these situations is pause, maybe get up on the balcony a little bit, look at the big picture, and then be curious. I even think about this in clinical decisions. Look, as infectious disease, we're a consultant. And generally we're working with surgeons and we work with other specialties, but I feel like a lot of our complicated cases end up being with surgeons. And look, I don't know, I'm not a surgeon, so it's hard for me to say particular things. So I have to be really curious. Help me understand is a phrase that I love. help me understand why you feel like we need antibiotics, or help me understand why you feel like we don't need antibiotics, or help me understand why we can or can't do this biopsy. And it's just a less charged way of trying to explore the situation. So I think a lot of times, we all have our opinions of how things are supposed to be done or how we think they're going to be done. Uh, the other thing I like to do is remind myself that everybody shows up with good intent to do the right thing clinically. They show up with good intent to do the right thing as a leader or a teacher. So if I'm frustrated with somebody, I need to just step back and say, like, look, they have good intentions. What's our mismatch? Why are we seeing this differently? But I think it puts it in a different light when I'm saying to myself that they mean well. Hopefully, I mean well. What's the nebulous or underlying this disagreement? Let me get curious about it and try to figure out where the difference is. And honestly, that curiosity requires both the humility to, one, recognize the need for it, and then two, you actually have to listen. You can't just be like, well, tell me your side, and then the whole time you're just waiting to explain to them why they're wrong, right? Like, you actually have to listen with this curiosity to potentially change your mind.
Yeah, I mean, I always use the parenting example of, listening to understand versus listening to respond. When my kids do something, mess up and I'm ready to punish them, they can talk and talk and talk. And I'm just thinking, what am I going to say to ground them for the next, 7 days or whatever? But I'm not listening. And I agree with you. You have to really take that time to listen, to understand. Another thing that you talk about in your book is, how delegation, being able to delegate appropriately and effectively is something that's good in leadership. Can you share an example from your career where you delegated effectively to support your team? And what is the takeaway for our listeners about learning to trust others, but still being accountable as that leader?
Great question. And I think you captured it, which is you are always sort of accountable as the leader, right? You're responsible, but you really do need to trust others. And I think one of the biggest lessons I've learned over the last couple years was sort of this epiphany that if if it's your job and I don't delegate it to you, the message I might be sending to you is that I don't respect and value your work. My intention might be like, well, Doug's really busy, so I'm not going to delegate this to him. I'll just do it. But if I don't tell you that or explain to you why I'm not delegating, it in many ways makes people feel undervalued, underappreciated, and that you don't think I can do the right work. So I think that's an important part, is that when we delegate, it really does show that we trust someone and that we think their work's important. And if we're not going to delegate because we think they're overwhelmed, then we should really tell them that's why we're doing it, just so there's no misunderstanding that, hey, I know you can do this, Doug, but I also know you have these 6 other things on your plate. So this time I got you. It's an act of empowerment as well. And I think one of the examples I use is, when I deployed, obviously we had to set up multiple aid stations because we were in different locations and we moved and did different things. But our battalion aid stations, I could have very easily went in as the, sort of senior medical person and directed and said how we were going to do things. That probably would have been the worst way to do it. Instead, what I did is I went in and I talked to our platoon leader, our platoon sergeant, and then some of our medics, and basically said, "Hey, look, it's your aid station. Like, do it, set it up, right?" And I empowered them to do it. And honestly, like, the way they set it up was probably way better than I would have set it up anyways. Did I have some tweaks and some things that I had seen and learned over some other experiences that maybe sharpened it and made it a little bit better? Yeah, absolutely. Did they then take away those lessons and learn them, and will they use them again? I hope so. But I think by delegating, we can really empower other people to, show what they're capable of. The other thing we need to think about when we delegate is it's a growth opportunity. So if I delegate to, my platoon, it gives them the opportunity to shine and to learn maybe new things. Or in the hospital, maybe I delegate a particular task to one of my residents. I would say many of the best ideas we ever had when I was program director were from residents. Hey, we want to start a new communication curriculum. You guys have some ideas? Run with it. We'll support you. We'll provide you the resources, the time, but I want you to do it. And again, you delegate, but then you coach and support so that those people can get better, learn skills, because eventually all of us are replaceable. Not in a bad way, but just we're going to move on to new roles, we're going to take new positions, we're going to retire, and delegation allows us to grow and develop sort of the next generation while we're in those leadership roles.
Yeah, I'm not sure where I heard this, but it really brought things clear to my mind about, delegating decisions. And I would have like a decision tree where, you could have a leaf decision. If a leaf falls off a tree, doesn't matter. Those are decisions you can make. Don't tell me about them. You got those decisions. The branches are a little bit more important, but you can lose a branch of tree. You don't lose the tree. So those are decisions that I want you to make. And if you make the wrong decisions, let me know what you learned. If you made the right decisions, let me know what you learned. Then there's the trunk ones. Maybe we should, those are important. I want you to make the decision, but let's talk about, the decision. And then, the root ones, we're going to make those together. And my goal as a leader is to get as many decisions out to the branches and leaves so you can, do what you need to do. And I trust you. And, you can come to me and I may say, hey, this is a branch decision. You can make it. That always helped me.
Yeah, I had not heard the tree sort of analogy before, but I will be borrowing that in the future. I love that. I think the other thing that as I was listening to you talk, that I was thinking about too, is that if we don't delegate decisions, which I think is a great example, it slows us down as an organization. If I have to run everything by you, and maybe three or four other people also have to run everything by you, everybody then is waiting for you, quote unquote, you as the leader to allow them to move whatever on. So it actually makes us way more efficient. But I did the tree analogy is terrific.
So one of the other things I really liked about your book is that, you brought real world examples about compassionate leadership. What is your favorite story from the book? And I know it's like, picking your favorite child, but what story really stood out to you? Said, man, that is a great example of somebody leading with compassion and caring.
There was a story that really struck me, and I feel very grateful that I got to. I mentioned Lieutenant General Hertling before. He told me a story about when he was deployed and during combat operations, and they had lost multiple service members, multiple killed in action in the same day. And obviously, at the end of that day, it was a pretty rough day. And he talked about how he was in his office and was pretty upset and was visibly upset. And one of his other senior leaders saw him and knew he was upset and actually sent the chaplain to go and check on him. The chaplain came in and talked to him and kind of helped him. We'll say regain composure, just feel a little bit better. He shared this story, and then when he went back and thanked the other person for it, the guy was like, I don't know what you're talking about. Like, denied that he had seen him and put in there that he had sent the chaplain, but he knew he had sent the chaplain. And I think to me, why the story was so powerful. I mean, one, obviously, it's militarily relevant and the responsibility that we have as commanders and officers for just great Americans who are willing to put their lives on the line for what we all believe in. And it was a very personal story. And that responsibility, again, going back to sort of what I mentioned before about seeing wounded, just emphasizes how important it is that we do our best as leaders. The other couple lessons I think from it were that leaders need support. It's hard to be a leader. It's a really sometimes lonely business, and that as followers, we can actually support our leaders by some of our actions. It's okay for you as a follower to go up to your leader and just be like, "Hey, sir, ma'am, thank you," or "Hey, sir, ma'am, you doing okay?" They're probably going to say yes, but I think that recognition that one, it's hard, and two, that we can support our leaders is really important. Just what do we do on a day-to-day basis to support each other? We're all in leader follower roles, but in healthcare we have one mission, and that's the patient, right? And I would add trainees too, right? Like we're training trainees to be healthcare providers, which ultimately are going to take care of the patient. Similarly, in the military, we have one mission, whatever that mission is at the time, to support our country. So the idea is, how do we make sure that we're always doing our best to support those missions?
You mentioned earlier about how important feedback is, and it's critical to leadership growth. And you talked about an example of the E8 that, reminded you that you were a standard bearer. Can you think of a specific time kind of in the medical sphere, where you were a clinician doing something that you received feedback that really stuck with you, whether it was really good, that person who gave you feedback was excellent at doing it, or man, I'm in the leadership lab. I never want to be somebody who's giving feedback like I'm getting right now.
So I have two stories potentially that I'll share. One of them, I was the assistant chief of graduate medical education at Walter Reed, and I had a Navy counterpart. So there was an Army assistant chief and a Navy assistant chief, and we were in a meeting. And I have no idea what the topic is. I can't remember, but I remember very vividly what happened after the meeting. We left the meeting, and my colleague just looked at me and he goes, "Wow, you must have been really pissed off in there." And I was like, what do you mean? He goes, when the person was talking, and it might have been General Clark actually. He probably wouldn't have noticed, or he may have. But this the my counterpart basically said to me, like, it was clear all over your face, like how, like, frustrated you were with this particular decision. And I was like, oh, like I had no idea that my body language, sort of my like emotional intelligence, was that visible to everyone else. And it really made me stop and think about, how do I carry myself in those types of meetings when people are, as you mentioned earlier, they're watching us, they're looking at us. And if they see me rolling my eyes or frustrated, one, it makes them think that's okay for them to do. But two, it's really, not appropriate. So I was really grateful that he gave me the feedback, because had he not given me the feedback, I'm not sure I would have picked up on it on my own. And, you know, could it have come back to haunt me? Maybe someone would have noticed, someone more senior, when I was frustrated with them, and then potentially them not being happy with, my performance or professionalism. So I was really grateful for the feedback that he gave me. The second story, and I did write about this one in the book, and I actually think this is really important for all of us, is we had an intern who, was struggling a little bit. And this was right after I had taken over the program, and I didn't feel like they were quite ready to finish intern year. And much like you mentioned in your story, they were going to go out and be in one of these sort of clinical leadership roles, very likely, once they left after intern year. And we essentially stopped them from leaving internship around June. And when we did that, the whole point was, hey, we want to make sure you're prepared. I don't want to send you out if you're not prepared. It's not fair to you. It's not fair to your patients and the other people you're going to be working with. And that was a really hard decision. The good news story is, the person got some additional training, successfully completed internship, just absolutely crushed their next assignment, and now is in, another training program and doing well. And had we not given that feedback, we don't know. They may have still done really well. But we certainly have heard other stories where people have not been given feedback or have not been held accountable, and then they have bad outcomes. That's on us. So the lesson really for me is that if we care about people, we have to give them that feedback. And for us, it's, if I care about patient care, I have to give them that feedback. Because if I don't give them the feedback, ultimately there's a patient at the end of whatever that, trainee, staff, colleague, nurse, whoever that is that needs the feedback.
So WarDocs has a fair number of younger listeners. And what advice would you give to a high school or college student who is interested or thinking about pursuing a career as a military healthcare professional?
I would say to them, and I actually had an opportunity just to talk to somebody recently who's a current ROTC student. I would say you've made a really great decision, or if you're thinking about it, it's an incredible opportunity. So when I think about my career, I got so much out of being a military medical corps officer. Obviously, I got college and med school, but what I really got was trained how to be an effective leader. And I think those skills, when I look back over the course of my career, like those skills that I learned have really set me up to do some of the other things that I've done. And even if you don't go into different leadership roles or positions, those skills are going to allow you to excel clinically. They're going to allow you to work really well with your nursing staff. They're going to allow you to work well with support staff. It's just going to help amplify your career. The other thing I would be remiss if I didn't say is that to be part of military medicine is an honor. Like, to be part of the historic legacy of the people who have been willing to put on the uniform to support our country. I mean, it's like what, less than 1% or something of people serve. So to do that to the rest of your life, you will have the identity of being a military medical corps officer. And I would suspect that whatever you do over your career, when you get to sort of later in your life and you look back, you're going to say, that's one of the highlights of my life. Being that Navy doc on that ship for that year, or working at Walter Reed and taking care of our patients, or being at Fort Polk, wherever you're at, it's such a unique honor to be part of that legacy. And you're always going to be part of that. I mean, I just think I was blessed that, I was able to serve in the 82nd Airborne Division. I don't think anything else that I've done in my entire life matches the sort of honor or pride that I feel when I see an 82nd Airborne Division patch. That to me is, you just can't replace that. And, being at Walter Reed, one of the most historic hospitals in our country, it's a really powerful thing. And I hope that everybody who's listening and thinking about a career in the military, one, we need you. We need people who are willing to step up and serve. And if you step up and serve, you get to be part of that legacy, and you get to take out of it all those skills which will help you be more successful.
So you talk about the legacy of, units like the 82nd and Walter Reed. When the history books are written 100, 150 years from now, how would you want the legacy of Josh Hartzell in military medicine to be recorded?
For me, it always comes back to, I want people that I've worked with, or people when they, it's kind of hard to think about people talking about you 100 years later, but I want them to know that he was someone who cared deeply about the people and the mission, and that he made people better leaders. If someone 20 years from now or 50 years from now said, oh, he made me a better leader, then I would feel like that's worthwhile. Because I know that if one person is a more effective leader from my influence, that's exponential, because that one person is going to interact with hundreds to thousands of people over their career and life. So every opportunity we get to make people more effective leaders, it's almost like, we talk preventive medicine, but it's exponential, because you get to carry those lessons forward for every future interaction you have with others. So yeah, it would just be someone who made me a better leader and a better person.
We've been speaking with Dr. Joshua Hartzell on WarDocs podcast. Josh, thanks again for sharing your experiences and insights. Thank you for writing this book and kind of cataloging some of the stuff we talked about. I encourage folks to get it. And thank you for your service to this nation.
Thanks for having me, Doug. I really appreciate the conversation.
Thank you for listening to WarDocs. We sure hope you enjoyed it. WarDocs is a nonprofit organization supported by donations from listeners like you. Please follow and subscribe to our show on whatever platform you consume your podcasts, and rate and review this episode, and share the show with your contacts on social media. Find out more information about our show, our guests, and how to become a member of Team WarDocs on WarDocsPodcast.com. Thank you for your support. If you like war stories and medical drama, WarDocs has you covered. Spread the word.